Hi, this is Chip with Total Motion Physical Therapy here in Raleigh, North Carolina. You're on this video now because you want to see our 30-second screen to see if physical therapy can help with something like your lower back pain that you've been struggling with. So maybe you got this yourself and a contact directly from us, or maybe someone forwarded this information to you. Either way, we're going to do a few motions here, and I want you to, as we do this, to pay close attention to where you feel what. Is it a pain, is it a tightness, and so forth. And make kind of mental notes of these things, because at the end we're going to talk about the key to see if this works for you, the meaning of physical therapy could be helpful for you. But also, if you decide to potentially contact us, we're going to want you to be able to tell us this information as well. Now again, this screen is something that all of our specialists in our clinic do. They do other tests as well. We do other tests as well, but this is a big portion of what we look at when we do things. So I want you to start off, we're going to kind of put your hands on your thighs, and you're going to start off by bending forward and down, sliding your hands like you're trying to reach down toward the floor the best you can. And again, pay attention to, did that feel tight, did that feel painful, or other things? Did you feel it in your back, or your leg, or hamstrings? Now we're going to do a similar thing now with my hands on my waist, still standing, and I'm going to bend backwards the farthest I think I can, or if you're looking at it from the sideways angle, it might look more like that. Keep your knees straight when you do that. Make sure you're arching your back backward, and pay attention to where you feel what. Now for this next movement, we're going to look at a side bend, still standing here, going as far as I can this way. Again, I'm paying attention to where does that stretch, pull, or compress me. But on this side bend movement, I also want to do a comparison game. We're going to think about how it felt to go that way. Now we're going to compare it to going this way to see if it feels different. Again, how's the range of motion? How's the stretch? So for example, in my case, I thought it felt more uncomfortable for me to go that way, kind of in here when I did that. So you might have had one different from the other. Make again a mental note of that. Now for the last one, you won't see my chair here for the sake of the video, but I'm going to actually sit down for this one. So I'm sitting at the moment. I'm going to put my hands kind of right here on my chest. On this one, I'm going to turn the farthest I think I can turn my body. Again, paying attention to how far I turn and where you feel that. And then compare this to the other side. Make sure you keep your legs straightened together in front of you when you do that. So again, where's the strain? How does it feel? Does that side feel different from that side? Those types of things. Alright, so now that we've done this test, now the next step is, how do we know if I'm a good physical therapy candidate or not? Well, if your problems when you did your range of motion were worse with the bending forward or bending backward test, this could be a nerve compression issue, like let's say maybe a disc, mostly if you're kind of in the below 50, 55 category more so. Or as we're older, if it's more worse in forward and backward, could be an arthritic or what we call a stenosis type of presentation with those type of movements as well. So these are things that demand a very specific type of program that our specialists are designed to help you with, and this is definitely something that we can help. If you find that your problem was more so worse in one of these directions, like meaning the turn or the side bend, but in particular if you notice that one side was less good than the other side, then this often implies that your problem even goes beyond the back. When God made our back, He put hips and knees and ribs and shoulders above and around it. So there's often usually a key area of tension in some of these other areas above or below the back that are pulling and feeding into the back area that are causing that presentation when we see that happen there. Now again, the symptom itself is going to be still in the back, but the cause of it may be elsewhere. This is about one of our more common presentations, and this is something again that you need someone, one of our specialists who's really good at seeing the full body mechanics when you test that, when you see that presentation. But again, something we can definitely help. There's a more rare category. Let's say your range of motion was fantastic in all those different directions and you felt no degree of tightness, no degree of strain and so forth. This again is more rare, but this usually again implies that you're getting back pain, kind of like in the last category, from some other restriction above or around it feeding attention into that area. So again, that would be the same type of presentation as our last one, where we'd have to again have some kind of good full body specialist who's good at looking at the whole system, which again we're pretty well trained to do. Now let's say you had one of the categories that I haven't mentioned there, something that you would say was a different type of presentation, like maybe your pain was equally bad on all of these motions, for example, or your range of motion wasn't any different, it was just as limited in all of these different directions. Well, this is again as a lesser common presentation. It's a little less clear as to whether or not you'd be a candidate on that. So in that case, you need to email me your specific results and I can tell you some thoughts on that. My email is on the web page below, chip@totalmotionpt.com. So do that screen. Again, it should be pretty quick. The video is not 30 seconds because I got to explain that, but the test itself, front, back, side, side, turn, turn, very simple. Look at the key to see if you fit one of those categories and let us know if that's something that you're interested in helping. But God bless. Hope you have a good rest of your day.